have often seen the younger kids as well get hearing problems, and we're here to speak to an audiologist, Dr. Richard Mwangi, a prolific doctor who has an extensive profile, top 40, under 40. A few years back, he has been published in some of the most known journals in the world, including the American Journal. Let the man tell us about himself, yeah? Let's meet Daktari. Daktari, thank you so much for agreeing to this interview. I have read your profile and it is extensive, yeah? Kindly introduce yourself.
My name is Richard Mwangi. I'm a consultant audiologist. I practice in different practices in Nairobi. Main office is at Gong Road, Fifth Avenue Office Suites. The other one is at Shepherd's Parklands, and there's another one at Shepherd's Nyayo Estate.
All right, okay. Now let us talk matters hearing. One of the greatest assumptions is that hearing loss is associated with the older generation. Have we seen the younger children experiencing cases of hearing loss as well?
Hearing loss, anybody can get it. But it is associated with aged people, where we say that it's age-related hearing impairment. But young adults, youth, even babies, children can get it. The reason is that there are different causes of this impairment. One, as many people know, is about the aging. But also, a baby or a child can be born with this hearing impairment, which you call congenital. Now, in young adults, they can have a disease that caused the hearing impairment, and also most recently we've seen the increase of using the stereo earbuds, where people are blasting the music. Even if you hold behind them, they can hardly hear you. Now that is another, can be a reason why the people are having the hearing impairment, which we call noise-induced hearing impairment. So hearing impairment can get anyone. Right. At any time of age.
All right. I am pretty shocked when you say that blasting music on our earphones can actually cause us ear loss. Does this hearing loss rather? Does this mean that we should not be using earphones for using our phones and our other devices?
No. You can use them. In fact, some phones have got some directives on how to use them. Won't mention the brands, but they apply a rule we call 60-60 rule. Okay. Now, when you're listening to using the stereo earbuds, is that you can use it at a maximum of 1 hour and take a break. Okay. Now that doesn't mean you use it 100% or 100% volume of the devices you're listening to, be it iPods, be it phones, or any other kind of device that is streaming music. But what you need to do is that guided by the manufacturer's device. There is the new devices that are coming up the market. They have got clear indications that if you go beyond this one, it can cause hearing impairment. In fact, when you do the volume up at that point, the color start changing in some selected devices. It can be from green, yellow, and red. Of course, red is not associated with something so good. And especially also you'll find that the sound is becoming too much, that you cannot be able to hear any other background noise or anybody talking to you.
All right, okay. And when you mention the noise from our earphones, yeah, I'm curious, how does the environment then that we live in affect our hearing?
The environment also, especially in different professionals, let's say, people in Juakali sector, military, by the virtue of using their tools of work, guns. Let's say even police, because of the same virtue, the quarry workers, because of, the what they use, when they are harvesting the stones, or even when they are doing the shaping of the stone. That's noise. Okay. Now, what happens is that if you work in such a kind of environment, you can use some things we call noise protectors, where you put it in your ear and it cuts out a bit of noise. Okay. Now that helps. So in occupation, in the professional, where there's too much noise from what you do, we always suggest or advise our patient, it's always good to use the noise blockers, which the noise plugs.
All right. Yeah. Maybe we need noise plugs for these matatus as well, yeah? That are usually so very loud. or does that duration of our journey, does it really affect for that short period where you're in a very noisy matatu, would it affect your hearing?
Incidentally, you'll see some of matatus written some funny stories, if it's too loud for you, you're too loud for this. So young people like it that way, and it's too much for them, and this is the matatus they use every day, day in, day out. They'll have an aspect of what you said of a noise-induced hearing impairment at some point. It is not instant. In most cases of hearing impairment, they are gradual, and there's no sign, there's no pain, there's nothing that directs you or suggests that you should go to the hospital. You find that the world just becomes quieter by the day. Now, when you talk of the matatu, there's also these people go clubbing. Okay, they like it too loud. They like the music too loud, and then some of them you find that when they are leaving the club, maybe in the morning, or the time that they are leaving, maybe midnight or late, very in the morning hours, you find that they have got some aspect of a level that they cannot be able to hear, what we call temporary threshold shift. Okay, that means the hearing, because of the noise of the club, has been affected temporarily, but to some individual it can be permanent. So the environment, about the noise, is something that should be taken care of, by the relevant bodies to control and to give, the standards of how the noise should be controlled.
Mm-hmm. You mentioned that hearing loss is gradual, yeah? What are the symptoms? How do I know? Does it prevent symptoms, or do I just wake up one day, all of a sudden I cannot hear anything?
No, it's not that. There's some instances we call sudden hearing impairment, which should be taken, very serious. But there are some other instances. In most cases, you find that the hearing impairment is very gradual, and that's the bigger percentage. So what happens is that, depending on the situation, we leave out the congenital part of it here. We concentrate on was it the disease? Was it noise? Is the aging process taking course? Now, when we start discussing that, you'll find that most people who come to us seeking, help into the hearing, they'll find that they have stayed a period of 5 to 7 years, because, in history taking, you'll ask the patient, at what time did you realize that the hearing impairment is checking in? It's about 3, 4, 5 years. Okay, so that's to answer your question, that there's no clear signs that you wake up today, and you find that the hearing impairment checked in, not only on sudden hearing impairment, which the ENTs take care of it very fast so that it doesn't go to become more of a.
All right. Okay. Now, when someone comes to you and presents with a case of hearing loss, how are you as a doctor able to help them?
In every visit to a doctor, one thing is that history taking is very important, because you don't want to learn, is this case related to the family issue? How does your patient, the patient in front of you, have they got into a use of some antimalarial drugs that causes a hearing impairment? And then you find that were they involved or in an accident, in any traumatic experience? What the job they do? History taking is very important. Now, when you take the history taking, of course, you go on to inspect the ear just to look whether there is an obstruction, whether the wax is too much impacted, and if it's too much impaction of wax, you clean it. Okay. Now, another thing is just to look at the physical appearance of the ear canal, and you find that the eardrum is intact, and from there you do the necessary test. Okay, you test the eardrum function, you find it's okay, then you test the hearing. When you test the hearing, of course, this person presented themselves because they have a hearing problem. There's different levels of hearing impairment, mild, moderately severe, and also the worst case scenario is profound impairment. That's more or less like saying it's a deaf case. Now, you would want to test the patient by giving some sound so that you can plot, a graph so that, you can be able to understand the severity of the problem. So after that, you discuss the patient, this is the result, this is the intervention that is supposed to be done. And you find that when you find there's no wax, or there was wax and you cleaned it, the eardrum function is good, and then you find the hearing impairment is of different kind of severity, the approach is to use the hearing devices. All right. You refer them to ENT surgeons for cochlear implantation, depending on the severity.
All right.
Yes.
Of hearing aids, yeah? Are these devices a one size fits all, or do you need different types of aids for different types of severity of the disease?
No, hearing aids is not that one size fits all, and that's that's what people, most people think, because you'll find them calling in and say, how much is a hearing aid? It's not something you get off the shelf. Having explained the process of taking in the patient to the diagnosis of the severity of the hearing impairment, you'll understand the same like happens to the, when you're getting the glasses, you have to get the severity of a case so that you can give the appropriate device. Now, hearing aids, the same way. So the hearing aids, there is obviously the standard one people have seen, which goes behind the ear. There's a very discreet one also that goes completely inside the ear. Now, depending on the severity, you choose that. Depending on the lifestyle of the patient, you choose a hearing aid. Depending on how, the connectivity, the Bluetooth controls, the rechargeable hearing aids, depending on some, the way the patient wants it to be, you select a hearing aid. Right. That means this wide range of hearing aids, depending on the choice, severity, how the patient wants to be, and also, user flexibility, because there are some also you control, smartphone controlled hearing aids.
All right.
Yeah.
When you speak of impaction of wax, yeah, what causes that? What causes? I have actually had an incident where a friend of mine had, I don't know, I think the parent was just trying to self-diagnose, yeah, and say this person has a lot of wax in the ear, so you need to put some oil inside to help drain out the wax. Let us talk about the myths and the assumptions that people have about wax in the ear.
I've heard stories about putting things in the ear. They'll say chicken oil, they'll say brake fluids. I mean, all those things are not needed. Mm-hmm. Okay? Ear in the wax, in the ear, comes out by itself. See, the skin inside the ear is like a conveyor belt. Mm-hmm. So it slides the wax out. Now, what causes the impaction? Very few people get impaction naturally, but in most cases, it's a mechanical thing. Now, the earbuds or the Q-tips that people buy from the supermarket or where they buy from, that's one of the major cause of wax impaction in the ear.
Really? I thought these earbuds are supposed to help us clean our ears and that they're a good thing to have.
Yes, that's what the population thinks. But even if you check on those, any brand of Q-tips or earbuds, is that you'll see a small writing, a small disclaimer there saying they are not supposed to be put in the ear canal. So when somebody is using them, and I normally say is that these Q-tips were made white deliberately. Because when you put it in the ear, it will come out brownish, and you may think that you're doing a good job, you're cleaning your ear, okay? And then you turn it around, you try to continue, it comes out brown. But what people don't realize is that the much you are putting into the ear, you're a little bit of wax, you're pushing it to an extent where, it cannot be able to come out by itself. So it starts building up slowly by slowly. Again, it's not, very fast thing. It happens gradually also. So you find that the wax builds up slowly. Unless somebody has got a big chunk of wax, you push it and then it blocks completely. But in most cases, you find that you push it a little bit, and then it gets built up to a place that no wax production happens there, and then you start having more fungus infection, the itchiness that people don't know how to describe. So those Q-tips, those earbuds, just read the small disclaimer that is there and understand. We normally say that the biggest part of your body that's supposed to go in the ear, or the biggest part, is an elbow. of course, that shows the impossibility of doing so.
For sure. That is true, Daktari. And when you mention it like that, yeah, I feel very educated. I had no clue that we're not supposed to use earbuds in our ears, yeah. I have seen in instances where children, when experiencing a fever or they're just unwell, they're tagging at their ears, yeah. Let's talk about the small babies who still cannot express themselves. How would you identify a child who has a problem with their hearing or their ears in general?
Ear, nose, throat, they're all interconnected. Okay? So when one is having a problem, especially when you're seeing about flu, is that even adults feel a bit congested. But we know how to pop up our ear. Remember, like the time you're flying, and when the plane is coming down, landing, you find that the ear blocks, okay? But when you choose something and it pops up, okay? But babies will not be able to do that, okay? Now, infection, or when you say about the flu, is that you find it presents other cases, fever, coughing. The first thing is to take to the pediatrician. You take the baby to the pediatrician, and the doctors will assess. The pediatrician will be able to assess by the look of the ear, by the color of the eardrum it presents itself. Pediatrician will be able to make a diagnosis. If this is happening quite often, they send them to the ENTs for diagnosis. Now, the ENTs might also send them to us as audiologists to do some testing just to see whether there's fluid, behind the eardrum, and that's how they make the diagnosis and give, treatment. Another thing you talked about is how you know whether the child has a hearing impairment. That's a very tricky one. Okay, but in countries in the West, the Europe, the America, all those countries, before the mother is discharged after giving birth, they do a test, so that when you discharge the baby, know that yes, this baby, the sight is good, the hearing is good, everything. Okay, here we have our way of doing things, but hearing, all those things are not checked. It's something we normally say, it's called newborn hearing screening. That's what the West countries do. Okay, so it's a screening test that assesses the cochlear function of a baby even before the mother's discharge. It can be done within a few hours after the baby is born, or even a day after a baby is born, and that gives us a clear a picture whether the baby is hearing or not. But this test, a baby can fail. Reason, maybe there's a bit of fluid in the ear, okay, or the baby was not cooperating, the baby was crying all over, the room is noisy, okay. So the test is supposed to be repeated after about 3 months. If the baby passes the test, you leave the baby to grow, and for sure this baby will develop the speech. If still the baby fails the test, you repeat it after 6 months. But this time you're repeating, if this child fails today's test, we are going to do diagnostic test and seek intervention, because there must be hearing impairment that need to be intervened before the baby grows too old. Because this is a milestone of a baby, from day one of birth to about 5 years there, is supposed to develop speech and good vocabularies, so that this baby can grow with the peers. So once the intervention is done at around 6 months, you'll find that the child will develop speech, with his or her peers at the same age, and life continues normal.
All right.
But here, what happens is that you find that we wait until 3 years, 4 years, because the baby is not bumbling. Then you're still in denial, you don't know what to do. You come to us for hearing assessment, we tell you this is the case, the baby has maybe a moderately severe or severe hearing impairment. Still you want to go to another person. Remember, the time is running out for speech development. So it is supposed to be assessed, during birth, or not, after 3 years. So this baby can develop speech.
All right. The association between not being able to hear and not being able to speak, maybe you can just clarify here how these two are interconnected. Why the correlation between the hearing and the speaking?
What will you talk if you've never had? What will you speak about if you've never had it?
All right, okay.
No.
That explains then why a lot of deaf people cannot speak.
If you're born with a hearing impairment and it was you find that, most cases will have severe to profound. If that is the case, you'll find that this person have never had a word and not speak a word. So that's why you find most people who are born with hearing impairment, no intervention was done, they don't talk. Okay, it's like you now. I tell you, I don't know how many foreign languages you know, but I tell you, let's just take, let's take Spanish. Okay, I went to school there. So let's say, you try to converse in that.
All right.
You can't, because you've not heard about it, you don't know about it, so it's not somewhere in your brain so that you talk about it. Okay, but you hear this person is talking, but you can understand.
Okay, all right. I think I understand that. Daktari, let us take a short, quick break here. And when we come back, guys, we will be learning more on how to take care better of our hearing. We will be right back.
Peterson, tumefutwa wote.
Yawa, pia wewe.
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako.
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title